All right, guys. So when we take an ECG paper, we see a lot of leads, right? What we call the 12 lead ECG paper that looks like this. You will see 12 different lines. Okay, some are represented by alphabets, some by Roman numerals and all that. What do they stand for? In this video, we will delve into understanding our 12 lead ECG and what each and every lead stands for. Once again, this is SmartNursing and you're welcome. Let's get right into it. So usually when we take an ECG, this is how we place our leads. We place some on the chest and then we also place them on the limbs of the patient. Okay, so we have limbs that we call limb leads, and then we have horizontal leads. Okay, so the limb leads are usually our lead 2, our lead 3, AVF, AVL, AVR. Those limbs look at the heart in a vertical plane. Okay, they look at the heart like directly in a vertical plane. And then we have the horizontal leads, the chest leads that look at the heart in a the horizontal plane. The chest leads that are V1, V2, V3, they're obviously chest leads because we place them on the chest of the patient this way. So those leads look at the heart in a horizontal plane. All right, so the vertical ones, the horizontal ones, they meet each other, form a resultant force, and that is what appears on the paper, what we see as the readings on the ECG, usually a resultant of those two planes coming together. So you have limbs looking at the heart from all angles, then they all come together, get a resultant and put on the paper as the ECG. You know that it's all about physics. Okay, this one coming, then we get the resultant and then we put it there. Now when it comes there like that, some groups of leads, just as it is designed or tested and proved or proven, they look at the heart in a particular angle. Okay, so we have leads that look at the right side of the heart, leads that look at the lateral side, those that look at the anterior, those that look at the inferior. Okay, so for example, for the inferior leads, our lead 2, lead 3, and AVF, they look at the inferior part of the heart. Okay, then our right side, we have our AVR, and then we also have our V1. They look at the right side of the heart. Now when you come to the lateral side, we have our lead 1 there, we have our AVL, our V5, and our V6. They look at the lateral part of the heart. Then the anterior side, we have V2, V3, and V4. So that is how it is designed. This is not something you need to break your head over. That is how it is. It's just like 1 + 1 is 2. We can't change it. It's tested, it's proven. Okay, so V1, AVR, look at the right side. Okay, lead 2, lead 3, and then AVF are inferior. Lead 1, lead 1, AVL, V5, V6, look at the lateral side of the heart. Then V2, V3, V4, look at the anterior, or sometimes the septum and arterial parts of the heart. And why is this even important? Why do you even need to know this or break our heads over this? It is important because it helps you make concrete impressions or concrete diagnosis, so that maybe you are thinking of ischemia, for example, or you are thinking of an acute coronary disease. We will talk about ACS or acute coronary disease in details, how it appears on the ECG, and try to go into the physiology and pathophysiology of it. Okay, but just for the benefit of this video, when you're thinking about an ischemia or you're thinking about a cardiac infarction, myocardial infarction or not, then you want to look at these leads that we call the congruent leads. We call them the congruent leads, just like the brothers and sisters, so that if you are looking at the inferior part, whatever you see at lead 2, you must see that thing at lead 3, you must see it as AVF. Okay, so when you see a problem, maybe you see a T-wave inversion in lead 2, you have to go to lead 3 and see if it's there. Go to AVF, and if you see that same pattern, then you can confidently say that there is a T-wave inversion in all these 3. So therefore, is possible ischemia. T wave inversion is a T wave that is down this way. You know, T waves are usually up. They are just like the P waves that are up. But if it's down the isoelectric line, then it is inverted. Okay, it has become negative. That is what we call T wave inversions. Among other things, it can mean ischemia. Okay, so when you see that in any lead, you have to look for the brothers and sisters of that lead or the congruent leads to see if you will find the same problem at those places. Then you can confidently say that this particular side of my heart has an issue. So basically, what have we been saying? We've been saying that the 12 lead that we see, they point at different parts of the heart. Okay, we have those that look at the inferior, those that look at the lateral, those that look at the right side, those that look at the anterior or the anterior septum of the heart. This is it. Another video once again, guys. ECG doesn't have to be complicated at all with SmartNursing in your corner. Thank you once again for watching. Thank you, our returning subscribers. If you're new here, what are you waiting for? Hit the subscribe button, like, share this video, and then we'll see you in another video.